We're very lucky today to have Dr. Sarah Hampton to talk about her Ph.D. study, which she completed at Cambridge University Autism Research Centre on childbirth and postnatal experiences of autistic mothers. Welcome, Sarah.
So at the moment, there's not a lot of research out there about how autistic people experience parenthood, including things like pregnancy, childbirth, and the postnatal period. So there's not a lot of information for healthcare professionals and clinicians to draw on when providing care for autistic people. So we wanted to understand a bit more about autistic people's experiences of childbirth in the postnatal period. So we interviewed 21 autistic parents around 2 to 3 months after they gave birth, and we also interviewed a group of 25 non-autistic parents. And this was so that we could compare experiences between autistic and non-autistic parents and have a better idea of what might be unique to autistic parents and what might be common to both autistic and non-autistic parents. So we looked at the data and we found that there were a lot of similarities between autistic and non-autistic parents' experiences, and there were also a few differences. So in relation to childbirth, the autistic group often talked about some challenges with the sensory aspects of childbirth. So this was things like kind of challenges with being touched by healthcare professionals during the birth, finding things like bright lights overwhelming, and particularly in the postnatal ward, finding kind of the noise of other people's babies crying, people coming and going, things like that. They tend to struggle with those things. So they really appreciated kind of sensory-based accommodations like dimming the lights and having their own room in the postnatal ward. And so both participants really appreciated having very clear information during the birth from professionals, and the autistic participants particularly emphasised this and really highlighted the need for very clear, direct information during the birth. And some autistic participants didn't always feel that they were kept informed during the birth in the way that they would like to be. And in terms of postnatal support, both autistic and non-autistic parents really valued continuity of care, so kind of getting to know particular professionals so that they get to know kind of their needs, and this was particularly emphasised in the autistic group. Autistic parents sometimes didn't always feel that professionals who they interacted with postnatally had a good understanding of autism, and this could sometimes mean that they felt that their autism diagnosis was overlooked and didn't always lead to getting sort of further support. And autistic parents sometimes struggled with kind of group-based support postnatally, so things like breastfeeding support in a group-based setting or parent and baby groups, and they could find it challenging to sort of make connections with other parents there. And they really often valued sort of peer support from other autistic parents so that they could share experiences with parents who might have more similar experiences to them. And in terms of things like parenting strengths and challenges, both groups did highlight some challenges, and some common challenges, things like lack of sleep and not having a lot of time to oneself. The autistic parents also sometimes had some additional sensory struggles, so things like with the sensory aspects of breastfeeding, finding breastfeeding particularly painful, for example. And a few autistic participants did also say they struggled with things like playing with their baby, like not necessarily knowing whether they were doing it right or doing it enough, and sometimes feeling a little bit nervous, sort of playing with their baby in front of other people in case they might judge how they were doing it. But both groups also highlighted strengths that they felt that they had as a parent. So this included things like being very patient and understanding their baby's needs. And the autistic group also highlighted some additional strengths. So things like understanding their baby's sensory needs, because we know autistic people can often have kind of sensory differences. So they felt that they were particularly able to understand things like that their baby needed to be held to feel secure and things like this. And autistic participants sometimes talked about having a strength in terms of persevering with parenting goals, making their child a special interest, and so being really good at persevering with things like breastfeeding or things that they might find challenging. Those are all the strengths mentioned there as well.
Amazing. Thanks so much, Sarah. There's definitely a lot of really important information there. And I really like how you highlighted some of those similarities between all mums, whether you're autistic or not. Just parenthood is challenging anyway. And I think it's great to highlight that all parents experience the same challenges, and the fact that there might be some additional areas that need to be considered. And these are the things that might end up being adjustments that are made within the childbirth setting, so that our professionals are aware, because we know that autism is such a heterogeneous population. And saying that you have autism to your medical provider doesn't mean they know exactly how you need to be supported. So I think some of that does require the individual to be more specific about whether it's the lighting that might be affecting them, whether they need information written in terms of how the childbirth process is going to go, who are the people involved in that process, and all that kind of information that can maybe lead to anxiety of what's unknown. I think as clinicians supporting our autistic mums, sometimes it's a bit about being an informal advocate and maybe also problem solving with our clients. Are there particular things that they're concerned about that could be addressed in a problem solving kind of way? You've given some really practical tips in your paper, things like giving clearer information and better training for professionals who work with autistic people. In Australia, we don't have a disability passport that kind of highlights your disability and the type of support, but that potentially could be something similar could be quite useful in terms of identifying what are the specific support needs someone has. Do you have anything else to add?
Absolutely. As you say, I think something that really came out was autistic participants not always feeling that professionals have a good understanding of autism. So more autism-related training for professionals would be really useful. Then again, as you say, participants also really highlighted that they appreciated when healthcare professionals worked with them as an individual and asked about their individual needs, and maybe if they didn't always have a great understanding of autism particularly, that they really wanted to understand the individual's needs, and that was really useful as well. And I think just in terms of some broad recommendations, yes, sensory accommodations during the birth seem to be a really important thing. So things like dimming the lights, if possible, making sure there's not too many people coming and going, having one's own room on the postnatal ward, for example. And making sure that there's really clear communication, and that could be written communication, or may depend on the preference of the particular person. Providing continuity of care seemed really important, both during the birth and postnatally. And providing more one-to-one support might be very useful for autistic parents as well, if they are someone who struggles a bit more with that based support.
Thanks so much for your time, Sarah.
Well, thank you.